Good morning, everyone. Welcome. I am Sharon Allen from CE Zoom, and I'm going to go over a couple instructions for attendees if this is your first time doing a webinar through CE Zoom. I want to assure you if you're watching right now and you follow the directions, you're going to receive CE credit for today. And welcome. This is the webinar for the CariFree Cooperative. And a couple things. So at the very end of the webinar, you're going to be given a verification code. And that will be during the Q&A towards the last end. This is a 1-hour webinar, 1CE. If you have any questions, please ask them in the Q&A box in the bottom, and they will be asked to the presenter at the end. When you're done with this webinar, take that verification code, come back to cezoom.com, log in, scroll down until you find the course, click the green verify button, and then you put that code that will be displayed at the end right there. Please don't ask for the code before the presenter's done speaking because it's distracting to the audience and to the speaker. And for now, I'm going to turn the time over to Jenny and Laura with the CariFree Cooperative.
Thank you, Sharon. And thank you to everyone for popping on today to listen to two really great presenters. We have Christine Taxin with us today, as well as Dr. Kim Kutsch. Dr. Kutsch is a retired dentist of 40 years. He is a prolific writer, thought leader, inventor, and researcher in the field of dental caries and minimally invasive dentistry. He acts as a reviewer of the Journal of the American Dental Association and Compendium. Dr. Kutsch is the CEO and founder of Dental Alliance Holdings, the manufacturers of the CariFree system, and is a scientific advisor of dental caries at the prestigious Kois Center. Dr. Kutsch's list of achievements goes on, and we are so fortunate to have our resident caries expert here with us today. So welcome, Dr. Kutsch.
Thank you, Jenny, and welcome everybody. We've got an exciting program for you today, and I'm looking forward to it.
Excellent. And we also have on Christine Taxin. Prior to starting her consulting firm, Links to Success, Christine worked for a large New York City hospital. She's managed a large dental practice and worked with coaching solutions and dynamic administrators. She has management training from the Las Vegas Institute and has been awarded Leader in Consulting for the past 4 years from Dentistry Today. Christine serves as an adjunct professor at New York University Dental School, as well as teaches medical dental cross-coding at Harvard Dental School. Christine is a nationally recognized speaker and author on the topics of medical billing in the dental office, compliance, and wellness dentistry. Please help me welcome Christine Taxin.
Christine, I think you're still on mute. If you'll start your video and your microphone. Christine, I think you're still on mute.
Sorry.
Hello. If you want to go ahead and start your video as well.
Mm-hmm.
And then if you'll share your screen with us.
Okay, can you see it?
Yes, we just can't see you.
You need to see me too?
Do you want us to see you? We would love to see you.
Okay, here we go. All right, here.
Christine, you're welcome to get started anytime. Go ahead.
Okay, thank you everyone for participating in an amazing time. And we're gonna make it fun, not just educational, but some fun. Because we're working with Dr. Kim Kutsch, and I am so excited. It's the first time I've seen him in a long time. He looks handsome as ever. And we're going to discuss today the changes that have happened, not only because of Corona, but because of the changes in the ADA and dentistry itself. We have grown and grown, and faster than we could have imagined. So if you want to profit this year, join us, because we're going to move and we're going to be great when we're finished with the changes that have happened and the understanding of what can be done and what will change your life. And it's not like I don't know about dentistry, because not only do I work in it, but I live in it. My husband is a dentist, and this year we were granted an amazing thing because our son graduated also. So it's very exciting, dentistry, for me, even though I've been in it for so long. One of the things that happened to me when we were still traveling was I am not an electronic person, and I plugged in my computer and the wire went on fire onto my jacket in California. And the amazing person that was there helping me with computer stuff kind of pushed me towards the wall to put the fire out on my jacket. And to this day, he stays in touch with me. And I always show this picture because the entire audience was there. And it was a surreal experience. But it's also what I call let's get fired up, and what we can do to fire you up. So it can change can happen if you want it to happen. And that's just about everything that we do. So think of going on a diet because you want to change because your child's wedding is coming up, or something that you really want, where you should really want these changes. And there's a few main things that have to be done. You really need to update your medical history to make sure that you have the ability to communicate the oral systemic transmission and their illnesses, because you want to have the opportunity to chat with that patient about those issues, medications they take, illnesses they have, and how did your family overcome the time of the closed office? You know, conversation with them. You were locked down, they were locked down. You know, spend a little time in saying, these are the changes that we made while this close down was taking place, and we'll always be there for you. And one thing that I point out to patients is dentistry has had more sterilization processes and more OSHA processes than any other field. And we've been doing a lot of this prior to the COVID, which is taking it to the highest level it could go to with the knowledge that we have today. And they will appreciate that. Teledentistry is here, growing, and it will bring in financial reward when you learn how to use it the correct way. You must support home care products because you have an obligation to give people one stop and follow-up visits, check into prior visit, not letting them come into the waiting room, pre-rinse before and after, and goodie bags that they can have in the parking lot while they're waiting for their appointment or to take home. So, and there are huge changes in the insurance industry. Why do I say these things? Well, there was a change in 2014, and still a lot of my providers that I work with on a daily basis don't know it. So let's talk about this. The definition of physician practitioner is not just a medical provider. It is also doctors of dental surgery or of dental medicine. And every state has a law in it that requires a provider to help a patient maximize their policies. So if they have medical insurance and they ask you to bill it, we're going to have to know how to do that. And we're going to be pretty much in charge of helping them because they don't know how, nor can anyone else help you unless you have a contract with them, because your personal MPI number and your business MPI number cannot be used by anyone except with permission from the provider. So here's my hubby and his hygienist, and they are, you know, wearing the N95 masks. They're working hard. We're doing an amazing job with our patients, and they're all coming back. And I think one of the biggest reasons was because we kept in touch with them throughout the close. And how do we do that? We did it with teledentistry. Renato was on the phone with every hygiene patient that either had an appointment or would have had an appointment in that closed down time, and giving them home care instructions. And Paul was on call for all emergencies and spoke to hundreds of patients that were afraid to come out, and helping them with products to help alleviate some of the issues they were having. And then our son graduated from dental school. We were so excited. We were ready to go for the ceremony and party with him, and we couldn't. And we're not the only family. Hundreds of thousands of people didn't get to see their children graduate. But we are so proud of him because he's doing his residency at the Veterans. And as you can see, he's ready to do dentistry at the Veterans Hospital. And he loves it, and he loves giving back to these amazing soldiers who have endured so much pain and have issues that he could help them with. And then a little bit about my family. My husband and I have 5 children, 1 girl, 4 boys, and we have lovely 2 grandsons. We do have a granddaughter who is 17. We have a new one coming. So our family's growing in leaps and bounds, but I thought this is one of my favorite pictures with my children. And you could see it was a long time ago because I look much younger right there. So I want to start with showing you what's changing. And the first thing that's changing is that the ADA did put into place a program for preventable dental emergencies, because Harvard did a study at their emergency room, and out of 120 million emergency visits, 85,000 of them were really dental visits that should take place. They have medical problems as an underlying diabetes, heart, lung, liver, thyroid, alcohol, patients on medication. But the hospitals, a lot of them don't have the ability to treat the infection in their oral cavity. So they write prescriptions, and we have found that a lot of people will only fill the opioid. Now with the opioid issue, we can't even give them an opioid unless they go to see somebody and have the treatment provided in a lot of the states. So the ADA did set up a program that you could get involved with so that emergency rooms around the country know who you are and can be referring to you. And this is a great source of income, and it's a great community intervention for these patients. Remember that most people that end up going to the emergency room, and we have a study of many people that have died because of this infection because they did not have it taken care of. And the last person was a young man in Florida who was 27 years old, a father of 1, and he ended up dying from the infection because he just didn't go to an oral physician's office, and the emergency room gave him an antibiotic and a prescription for pain, and he never made it. So we are working hard on getting that together. This year, Alex Azar said there is no turning back to an unsustainable system that pays for procedures rather than value. And what does he mean by that? We're changing everything about dentistry. We are diagnosing, and we understand more science than ever before. And oral hygiene can put you at risk if you have any underlying conditions. And believe it or not, COVID really is a viral respiratory inflammation disease of the lungs, and it creates a havoc in the body. And we know that we have been taking care of patients in hospitals to decrease their pneumonia issues, and we know that the potential for bacteria to worsen viral illnesses is real. So we're really working with the ADA to get that word out, and we should be getting that word out. We should be spreading the word that we are the physicians of the oral cavity, and that we can help with cleaning their oral cavity and helping them stay healthier. That's pretty strong wording. And we've been teaching that for a while, but we haven't really made a difference. This is what the coronavirus looked like in the oral cavity. This is a picture of a patient in the worst area of New York City and the hardest hospital to be there. And the story behind this is that I have two dentists in California. Their daughter came here to be in medical school, and she ended up doing a residency at Elmhurst Hospital. And she called me up and she goes, I have to send you this because we should have dentistry opened. And I said, what are you sending me? She goes, I'm sending you a picture of coronavirus in the oral cavity and why so many people needed ventilators, because by the time they got to the emergency room, there was nothing we could do in the oral cavity to help this patient. They had to go on a ventilator. And it was pretty scary to me when I first saw this. But we could have seen it before it got to this point. And not that we could cure coronavirus, but we could direct these patients into the places that they could be. And don't forget that the oral cavity is connected to so many organs in the body. And here we are looking at it without being invasive. And I always said this, we are the only providers that do not have to cut open something or be invasive with tubes to see what's going on in the patient's body. And it might not have been corona, but canker sores are an issue. Patients that take medication are issues. And so we see how hard this took. And so we know that they announced in Wuhan, China in December of 2019, and that it was a new coronavirus. But since saliva can host several viruses, the transmission chance of viruses through saliva, particularly those causing respiratory infection, is unavoidable. And this comes from all the science that's out there right now. And Decision Magazine also had an article from the president of the ADA, and the executive and all of them. Dentistry is an essential healthcare service, and dentists and their teams are essential healthcare workers. We applaud your thoughtful consideration of how to allocate the early supply of a safe and effective coronavirus vaccine. We will be just like medical providers when this is going on. When the vaccine comes out, we will be first in line so that we could continue to help save lives, help people understand how amazing this is. And please take a look at this article for yourself to really read the whole thing and see how many changes the ADA and the science has made for us. They also said dentistry is an essential healthcare, and doing so will help people maintain their oral health and contribute to their overall health. Oral health is integral to overall health, and staying well often depends on having access to healthcare, which includes dental treatment. And so I want you to really go onto the ADA. If you're a member, you could get all of these articles. I'm sure that if you call them, you could get the articles, and the volume that it was in was 51. Because it's recognized as an oral medicine and all the changes, we also instituted the 11th dental specialty recognized by the National Commission on Recognition of Dental Specialties. So if you were my son, for example, and you wanted to do a residency and a specialty, you can do the oral medicine residency, and these people will provide primary dental care for those with complex medical issues that require long-term management or modifications in the delivery of oral health because of their medical status. Now imagine that. Now, I have a lot of doctors that haven't become the 11th dental specialty, but have joined many organizations that have given them the sense of need for patients with diabetes, for instance, seeing them every 3 months versus once a year or twice a year, because we know what to do. And dentists that are already practicing can join the organization. I'm giving you the publication. Join the organization, take CEs with them, and then become certified in the oral medicine program in a different way than the young students leaving schools today. Our number one concern is gum disease. People still believe that they're coming in to fix a tooth. That is not our overall goal. Of course, it's part of it, but our overall goal is to show people that what happens in the oral cavity affects their whole body. And these statistics come from the Oral Systemic Organization, and it is heart disease. If you have heart disease, you're 700 times at risk. And rheumatoid arthritis or aspiration for pneumonia and preterm birth. We need to get that word out that patients that are pregnant or becoming pregnant, now that they actually plan their pregnancies, they go on prenatal in advance, they do a lot of things to keep their children healthy, and having them come into the office is exactly another one of the issues that we need to start to address with our patients. And rheumatoid arthritis is an important topic for me because it is an autoimmune, and we don't look at rheumatoid arthritis as an illness we need to worry about in the oral cavity. But autoimmune diseases come in many forms. Rheumatoid arthritis, lupus. I have one doctor who's a specialist with sickle cell patients, and another doctor who's dealing with the oral cancer facilities in his area. And they've made specialties within their practices just to do some of these things with patients that have some sort of underlying condition, and have connected with doctors around the country to work with them, not against them, with them, so that their patients get the best care. Transmission, and one of the things that I loved about working with Dr. Kutsch is how I learned medical billing and why I went into medical billing. Because I met them when they first had their product coming out, and my daughter was diagnosed, and we realized that there was something going on. Now, her father's a dentist. I've been in the field, and here she is, 18 years old, needing root canals and extractions, and it was just a nightmare. And we realized that, children do get vertical transmission from parent to child. So if you have an infection in your oral cavity and you kiss your children or you kiss your boyfriend, you can be transmitting back and forth. And saliva is the major vector for transmission. So it's not just kissing. It's going to the restaurant and having a birthday cake for one person in your family. And as you could see, we're a pretty big family, and we buy a cake and everybody would share that cake with a fork of their own. But we never realized that when you put that fork back in, it's like double dipping, and those saliva transmissions are there. It makes you think about sharing that way from now on. Transmission comes in so many ways. My favorite are the two cats. Yes, they kiss. And cats kiss, and dogs kiss, and kids kiss, and adults kiss. But what could happen when you share something or kiss somebody is, here's the pneumonia that could happen in your chest just because you went ahead and transmitted this infection. And so it relates to the overall risk, and the science is very clear. And in the state of New York, we had to beg, borrow, and steal to have our commission allow hygienists to go into nursing homes and help patients, because the nurses couldn't do it, and the aides couldn't do it, and the family is not exactly capable of doing all of it, even though they tried. So once we got them in there, we realized that we actually brought down the rate of pneumonia, which actually saved a lot of people. And I was privileged to work with a lot of the doctors that were doing research. And we worked with hospitals in Albany who we set up 2 separate practices, one for children only and one for the family. And we realized that keeping the children healthy, when they came back, they still had more disease. But we realized that the families that got healthy together had less recurrence. And we realized that if we don't get the parents healthy, we're never going to get the kids healthy. And so we changed the way we did it, and we really put both of those clinics to full family, and we saw tremendous change in oral decay. So what did we do? My husband's office, and Renata, as you saw, she's an amazing hygienist. I think my husband's pretty amazing too. We did check-in at the parking lot. So our patients would text us when they got to the parking lot. If they hadn't downloaded all their forms, which we recommended, that's why we did a teledentistry with them when they made an appointment to show them how to do it. We had all their health history. We had their coronavirus form filled out. We had everything ready for them. We even pre-authorized insurances through the medical if needed. We delivered to the parking lot a goodie bag full of samples, lollipops, sprays, things like that, so they could have one before entering the office, which helped the team, really. Once they got in, we actually had them go into the restroom. They washed their hands, their face, and they free rinsed right in the restroom. And we had somebody on the team that was constantly cleaning up the restrooms because of the sink and the garbage. They were brought into the operatory and they pre-rinsed again. That was for the safety of the team. Even though the patients knew it was better for them, it truly was for the team, because we decided that we had to protect our team as much as we helped protect our patients. So we really did a lot. And the first thing we did when they got into the chair, if the doctor was not ready yet, the hygienist or the assistant started to talk about what the products we were using, why we were using them, and what good they were, and recommended that the patients would take some home so that they could keep their oral cavities as disinfected as possible. What forms you need, I just wanted to go over with you what we used and how we used it. And I want you to look at the medical history that we used. The first thing that we saw was diabetes, but we make sure there is a list of all the illnesses that are possibly connected to the oral cavity. Of course, there are so many more. And we really went over our medical histories with the patient. Our front desk, when they did the teledentistry with the patient, went over the medical form with them. We didn't just send it to them to fill out and send back. We actually reviewed it. And it really paid off for us because we started to get the information we needed from patients much faster. We asked about different medications, so we knew what was going on before that patient came in. That also helped us decide whether we should bill medical or dental. Now, we had been doing it. I don't recommend you start doing that before you know how, but it does give you what kind of insurance should we be billing for this patient. By the fact that she's diabetic, she's on insulin, she's a high risk. A high risk can get medical coverage. So that's what we did. So we asked them to scan in their medical and dental insurance cards, or they would show them to our front desk. We would take down the information and we would tell them what to do when they got to the parking lot. And then it allowed our administration team from having to wear the N95 mask at the front desk all day. I mean, they needed to be able to answer the phone. They needed to be able to do things. So we actually ended up equal. Instead of spending the money on the PPE for them, because they were in a room on their own, still dealing face-to-face with our patients in many ways, we didn't use that PPE for them. They just wore paper masks, regular masks, and our patients praised us. They loved what we were doing. We also used Previsor, and we did that through teledentistry also. And if they weren't able to log on to one of them, either through CariFree or Previsor, one of these forms, we had them do it with us on teledentistry so that we could help score them. Now, you could say, why'd you do that? Because you knew that that person was diabetic. Yes, we did know that person was diabetic. So we could have skipped it on that instance, but it's always better to have more information than too little information. And our front desk actually loved being involved with the patients to this level. And because we weren't doing paper in the office, they were able to engage with patients like never before. So actually, our patients don't want to go back to coming in, filling out the paperwork, and then having the front desk person just insert it and waiting to collect money. Everything was done on that call, and they gave them as much time as needed. So here's a patient that we did do on teledentistry. She was pregnant. We did a teledentistry. After that, doctor spoke with her OBGYN, and we received a letter. But he was funny. He said to Dr. Taxin, I don't understand why dentists just don't see pregnant women. If they have an infection, the baby has the infection. So please see our pregnant patients. We don't want them to have an infection. And it was really an eye-opener with him and for him. But we wanted to make sure that any products we used were okay. We wanted to make sure that if we needed him, he was available. And we did. So we really, the following day, you know, she came in the office from the parking lot. She already got everything was done. We even went and spoke to her doctor to ask about the product. So we were able to use the rinse CT X4, and she sat in the chair. We asked her to rinse again. We cleaned all the sinks after every risk to eliminate any risk. We treated Zay, and she was very comfortable before, during, and after. We then provided her with a home care to use and asked her to set up a teleconference with our hygienist, who went over all the oral care during the next week, not in person, so that we could continue to see more people in office, keep the operatories clean, and do home care training, nutritional training on teledentistry. And our hygienists loved it, our patients loved it, and we saved them a visit. So we really went above and beyond. But we do have this picture up in our operatories. And if we didn't provide treatment to Zay, her infection would have caused issues with her unborn child. Pregnancy and birth complications. Periodontitis has been linked to premature birth and low birth weight. And Dr. Roy Page, a very prominent periodontist in Seattle, said, if a patient with moderate to severe periodontal disease, the amount of gingival surface area involved in the disease is about the same surface area as the palm of the hand. If you went to a hospital ER with the palm of your hand bleeding and swollen, you would either be admitted on the spot or you would definitely be treated. And nobody would ask, would you want to be treated? Although we need to ask approval from our patient to take care of them, we should give them something to compare it with so they understand the need and they will accept treatment. Cigna, and I won't play this, but Cigna Dental Oral Health Integration Program is a really amazing program. And it will cover pregnancy, diabetes, all of the things that we just talked about more times a year covered. So Cigna, Blue Cross, so many dental plans now have the oral integration program. We don't go to medical after we treat if they have this available because it's easier for them. And what it means is they are getting the coverage for those additional visits. Every plan works a little different. Cigna pays the patient back, so they pay us. Delta pays the doctor, and the patient only has to pay their copayment. And it gives you what's covered, how it's covered, and everything about it. So if you're not ready to bill medical, at least take advantage of these integration programs for patients that are diabetic, for patients that are pregnant, have heart disease, kidney disease, because it will make a difference. This is Delta Dental. Now, you know, it's called Health Through oralwellness.com/home. And it does ask you to do the previsor, which is another reason we always do it, or the risk assessments scoring through CariFree. I don't care where you do it, but this is the extra stuff they get according to the scores that they have. So for caries, they will actually let you do a caries susceptibility test once every 12 months, a prophy, or a combination of up to 4 in 12 months. Scaling in the presence of gingival inflammation, they cover fluoride or topical varnish, and it gives you all of the additional things. You actually get paid for nutritional counseling, oral hygiene instruction, sealants, and so on and so forth. So it's really important to get involved in these programs because you are going to be helping more patients at a better rate and really truly helping them stay healthy. And the word transmission is no longer something patients don't understand because everything we've done for the last 6 months has the word transmission in it. So we have the perfect opportunity now to start to repeat, and show our patients that we're there to not just fix a tooth, but to help the patient stay healthy. So now I'm going to introduce you to Dr. Kutsch. I love his name, Dr. Kutsch. It sounds like we're going back in time, and I'm sorry. I know this is something we're going to play, and that's not playing. So Dr. Kutsch, are you available to speak to us a little bit?
Yes, I'm trying. Yes, Christine, I'm trying to get my video going, and
yeah, I know. I
here.
Can't seem to play this, but we'll tell them where to find it on.
Yeah. So when we talk about the use of pre-rinse, and we look at Christina, you're really hitting the target here today on a topic that I think is really. This is where we're at in the profession, and I'm enjoying your presentation. And I would like to add too. I am really proud of the efforts that our profession has made in terms of responding to this pandemic. And we've always had really good protocols for infection control, you know, I think the dental office today is probably the safest place
Yeah.
in the world you can be, right?
Yeah,
Because we have
and
no protocol.
our patients and many of my providers are saying the same thing. Their patients have said, well, we never were afraid to come in here. And now we feel even more comfortable. So it's been a really huge change.
Yeah, and so I think that you know, we're seeing our patients come back, and we've done more in terms of infection control than literally anything that I can think of. You know, the whole topic of aerosol started when we introduced some of the instruments, the air water syringe, the high-speed handpiece, the ultrasonic handpiece. And, you know, you look at the spread of infectious disease as a risk for the dental practitioners and the dental professionals as a result of being exposed to that biological cloud all day long. And we've been studying this since 1969 in dentistry. And, you know, fortunately, there haven't been a lot of diseases that have been transmitted to us, but it still puts us at risk for other things like idiopathic pulmonary fibrosis. And then we get the, you know, things like SARS-CoV-2 comes up. And so one of the things, if we look at how do we reduce that risk, of course, the obvious things are the PPE, like you've been talking about, but then also the pre-rinse. And if we go back to Harrell and Molinari's work, the paper in 2004 in JADA, I mean, one of the things they identified was use of a pre-rinse significantly reduces the amount of pathogen load in that aerosol that we're still exposed to, even in spite of the fact we're wearing all this PPE. You know, so some of those ingredients that have been studied, particularly for the SARS-CoV-2 this year, 70% ethanol, which I don't really think you want to give your patients a 70% ethanol, but a 0.5 hydrogen peroxide or a 0.1% sodium hypochlorite. And sodium hypochlorite has shown up in a number of different studies as being very, very effective against the SARS-CoV-2 virus specifically. And so that's one of the ingredients that I work with, you know, in our pre-rinse and, you know, in the CariFree product line. So we've been using that for years to treat dental caries. And I think that certainly I know a lot of practitioners are using that today. And I think it's just really important. There's a lot of different products on the market, but I think it's really important that everybody start using a pre-rinse and, you know, for their patients for every procedure. And I don't see that going away. I think this is going to be a new normal for us. And I think it's a good thing. Every time we add a bit to our protocol that makes our work environment safer for ourselves, it makes it safer for our patients and everybody. I mean, you and I are not going to, we're not going to go back and stop wearing masks and gloves. And so I think once we get this new kind of protocol for the pre-rinse and then looking at maybe even things like external vacuums to control that aerosol, I don't think we're going to go back from that. I think this is a new part of our standard protocol. So I'd encourage everybody to take that seriously and make that an always in their practice, Christine.
And just to, you know, say one thing about this product with the CX4. Not one patient complained. We did have, I'm going to be honest, we did have another product and they wouldn't use it. They would refuse to use it. It was so horrific. And we've always had CariFree, but we didn't have the X4 until I learned about it. We got the X4 and not one patient either said to us, we don't want to bring it home. They all want it home. And it's because they understand transmission so much better than ever before, that they're bringing a lot of the things home. And like the lollipops, I myself have used them for years because I know that kids will do that, but they're not going to stand there doing all the other things, and may not be as good as the rinse, but it's something. And patients were saying to us in many instances that they had no problem using home care products, which is a big switch because they usually said, oh, we'll get it at CVS or we'll get it here. And they were ready to get it because they understand the difference today than ever before. So we just wanted to show you some of the research that shows certain conditions that could affect your oral cavity. And I'm so glad Dr. Kutsch brought up, like, we've been sterilizing and learning all of this way before doctors did. I mean, doctors put their stethoscope around the neck and use it all day long on the different patients. And that may not be the worst thing, but it's also not good. And when the HIV AIDS problem came about, dentistry really started OSHA, full blast. And we know so many other things are really affecting patients. And one of the things that we've seen really come to fruition in Alzheimer's, and Alzheimer's comes, you think you're just getting old, but you're not. You are having a disease. And believe it or not, the oral cavity is very important to people that are going into that age group, that are going into Alzheimer's, because the worsening oral health is seen in Alzheimer's. And we don't want to have that. We could prevent a lot of it. We have specific diabetic ICD-10 codes. It's amazing, diagnostic codes. But the thing I wanted to just chat about was having in the office the HbA blood tests. And there are 2 dental codes that could be used according to what you're using. But my question is, why aren't more doctors doing that? It's not that you're going to diagnose the patient. You're really just performing an encounter for screening for diabetes. When a patient says there's nothing wrong, they have no illnesses, but they come in with red swollen gums, they have something wrong. And by testing, we could refer them to somebody that could help them. We could help them, and their medical doctor could help them. So please, if you have more questions on this, I would be happy to help you. The insurance plans are changing everything that you thought you knew. Consumers have been monitored, and they are looking for simplicity, and there are huge gains to be had on the medical side by properly managing oral health. It's not like the mouth isn't connected to the body. When I saw that at a meeting, I was shocked from an insurance perspective. And we are moving a lot of dental into medical plans, or if you look at Medicare, and I call that program of mine, Medicare is not your grandma's anymore, because Medicare Advantage has become so widespread, and patients have the ability to add on what they want. Look at the dental insurances that have added on the integration. So we have different ways of helping patients not only get the right treatment, but actually help them pay for the treatment. And the survey has gone in that the young adults, millennials, want one-stop shopping like Amazon. They don't want to go to 3 other doctors. So just so you know that we want to bring everything to fruition in our practices. And that is why DSOs are so huge, because it's one-stop shopping. And also, if somebody can deliver the technology to make bundling work for medical carriers, it could change the game plan. And what does that mean? Well, if you're diabetic, you really need to get the treatment. So they want that to be part of the diabetic treatment. So things are changing even in the insurance world. Medicare Advantage, these are the statistics. They're huge. Every state is growing in it, and there are more people going into it every day. The teledentistry is huge. And actually, the American Dental Association, again, has stepped up and is working with more insurance companies to procure more benefits for this part of it, and to leverage patient relationships you already have by using it, which is something that many of the providers I work with have done. And we've really taken advantage of that. And just so you could see, we had 250,000 patients doing teledentistry in 2013. And after this, 3.2 million patients in 2018, and we can't even give you numbers yet because the year is not over, but I'm going to tell you it's going to be somewhere over 6 million, maybe 7 million patients have been seen by teledentistry. So, I mean, if you're not doing it, there are plenty of platforms that you can use. They have all the consent forms in it. You have to get a consent form, you have to get certain paperwork, or you could integrate your own. The patient's attitude is 78% of respondents believe that teledentistry will be here to stay within the next 5 years. And it's just growing very quickly after this coronavirus. And they loved it. So you have to know your state laws. And this particular site is a teledentistry site, but what's on it are the states that allow teledentistry. And if they don't, it's who you could get in touch with. But remember that teledentistry is mandated through your state. So make sure you know your state laws. The codes that could be billed, I mean, limited oral evaluation, reevaluation, again, reevaluation if they had a surgical extraction and you want to check up on them, case management codes. But the biggest thing is we estimated how much money we were saving by doing teledentistry and not using PPE for every visit that came in. So the average office visit would increase, right? I mean, it would increase. So we looked at the average cost of the teledentistry system and that we could save 10 visits a week in our practice versus them coming in for all of those. Now remember, the aerosol goes up, we have to wait 15 minutes to even clean the room properly. So we're unable to see the amount of people in our practices as we once were. And the savings is high since the only cost is the teledentistry itself, and you can still bill for it. And the insurances cannot change the fee you bill for. The fee is the fee is the fee. So if you're working with Cigna Dental, and you get $68 for an office visit, you have to get $68 for a teledentistry visit. But no matter whether you're billing or not, you're saving a lot of money, you're saving a lot of time, and you're giving your patients extremely amazing treatment. The E&M visits, 2 new codes are coming out this year for dentistry, and it's the antigen testing for public health related pathogen, including coronavirus, and the antibody testing for public health related pathogen, including coronavirus. I gave you the website because this is not enough for you to have, and you could look at the AMA website. But a patient comes into your office and you're doing the test, and you're billing for the visit, new or established patient. What you're billing for is not the test itself. What you're billing for is the lab handling and conveyance. You're taking a test and sending it to a lab to be diagnosed. The lab does the diagnosis and sends it back to you. If you're billing medical, you can bill that you did this test with one of the 3 diagnostic codes here that are eligible for medical billing within the dental to do the antibody test. Now, these are dental codes. That doesn't mean you can't bill for it because you're actually not billing the dental code. You're actually billing the medical collection code. What I am giving you is because we don't even know if any dental is going to pay for it, but I do know medical is. And so I wanted to give you what I know for sure because we haven't gotten answers back from most of the dental plans. But I'm going to say this. Dental doesn't pay for the blood testing for the diabetes. Medical does. Dental doesn't even pay for bone grafts anymore, but medical does. So I'm going to assume, maybe I'm wrong to assume, but assume that this would be covered. And I wanted to show you the picture of Z's baby, Logan. And she sent this to us to show us how lucky she felt that she was part of our life. Have you ever seen a GP office hang up baby pictures? It's usually pedo offices and OBGYN. And I want to say thank you to Dr. Kutsch. I want to give you the number that you can call. These books have been on my desk forever because the book Balance was out a long time ago, and I've used it like a Bible. I don't know if you could see it. And then I was sent Why Me? And hey, my kid said, "You always say that, Ma. Why me?" Because I have to dust or clean. Why me? But they're great books. They're great products. I love the company, and I love Dr. Kutsch and the way he teaches it, and the science, and Jenny and Lori and everybody that works there, because it's much more family than anything else. So thank you so much for your time. I went a little over, but I'm sorry. So Jenny, take it over.
Thank you so much, Christine. We really appreciate you taking the time and sharing with us more information in your message. And you didn't, I think the time is pretty good. You did really good.
Okay.
And Dr. Kutsch, did you have any final words or anything that you wanted to add?
No, I just thought it was a great presentation, and the two new codes were that was news to me as well. So thank you, Christine. I think that was a really good overview, and I love your expertise on medical billing, and I think there's a future for us here.
Oh yeah, there's a big future. Big. I think we're going to just fly forward, and the ADA's backing has really helped us move from dentistry to oral medicine. And I'm so proud of them for this.
And to everyone that is listening, we do have the code and that we will display here in just a moment. And we do have some questions about the slides and if those will be available. We will be sending a follow-up email to everyone that was registered. And if you are interested in those slides or in a copy of Dr. Kutsch's books, just reply back and let us know, and we're happy to send you free copies of that, as well as the slides and any other information, any other questions that you had on Christine's presentation. We can get those answered for you.